Good morning, happy Monday, and welcome to another episode of Coffee Talk Live. This is the show where my guest and I explore what it means to live a happy, healthy, sustainable life as mothers, as women in the home and in the community. So I'm your host, Connie Pastorius, coming at you from my vacation cottage in Montauk. We'll talk more about that in a minute. But I am the founder of Pastorius Fitness, which is online coaching for overwhelmed moms who are ready to get stronger, gain energy, and reclaim their health. I'm also the woman in charge here at Strong as a Mother, Happy and Healthy Living, which is a Facebook group whose mission is to be the village for moms to feel supported so they can live a healthy and happy life while raising healthy and happy babies. So do me a favor, drop a 1 or a hello in the comments if you're watching live, or a 2 if you're catching the replay. And please don't be shy. This is a conversation meant for all of us. So please feel free to add your questions. We'll either answer them in the conversation or afterwards. And if you're watching on YouTube as the replay, please like, share, and subscribe so I know that you want to keep getting more of this awesome content each and every week. So let's get to why we are here today. I'm so excited to talk with today's guest because he is a husband, a dad, McGill Method certified practitioner, a postpartum corrective exercise specialist, and he himself is a recovered back pain sufferer. So if that's not awesome enough, he also graduated from the same exact university program I did, but just a year or 2 earlier. So the universe has brought us together. Please welcome to the show, all the way from Tel Aviv, Israel, Menachem Brodie. Welcome, Menachem.
Hey, Connie, how are you?
I'm so happy to see you, and with that shirt on today.
Oh yeah, we have to represent.
So this is crazy. What year did you graduate from Pitt? Undergrad.
Undergrad, 2008. 2008.
Okay. So I graduated in 2011. We might have crossed paths at one way or another, but now we are both in a cohort of the highest level of online trainers in the world. And I think I wore a Pitt hoodie one day and you're just like, we need to talk about that.
Yeah. It was one of the live calls. That was one of the best parts of being in a program like that is, as you know, there's 50, 60 students. It really does feel like a family. I mean, I still talk to some of the professors. I had Dr. Furtman as one of my clients. And his wife. So there's always that connection, you know, it's not like, oh, I went to Cornell, and I'm not saying that against them, but where you're like, yeah, there's 400 people in my program. It's just a big family.
Yeah, so small, and you get to hang out with them or continue following their journeys, especially now in the age of Facebook, which is one of the reasons why I love the internet and Facebook, because you're on the other side of the world, sort of. So what time is it right now in Tel Aviv?
5:05 p.m. So we're 7 hours ahead. So we're 2/3 of the way around the world.
Okay. We won't go into math and geography. It's not my special skill. So, okay, 5 p.m. What's in the cup at this hour for you?
Well, we've got a very special cup my wife made. That's my son and me with the coffee ritual for Chemex in the morning.
Oh, yay.
And it says, it's a family thing. She says that I ruined her for coffee. She used to drink Nesquik rather. Nesquik? No, Nescafe.
Yeah.
But this is a single origin coffee from a roaster whom your roaster bought their roasting machine from this guy, which is
that's amazing. So if anybody who remembers the episode for Mighty Oak Roasters a couple weeks ago, he ordered his very specific wood fire roaster from Tel Aviv. So what a small world. It keeps getting smaller. So you are caffeinating at this hour then?
Yes. Oh, yes, especially with a little one at home.
Yes. Oh my God. Yeah. Wow. So I'm having, so normally I have that like high quality fancy coffee as well, but I decided to change it up and see. So I also like to explore because I believe good coffee can come from anywhere. And when I was stocking up for our trip, we were at Target, and Target had like their brand of fair trade certified coffee that had like coconut essential like flavor in it without the sugar. So I'm having like a little tropical coffee treat and I'm loving it.
Yeah. Well, that's the beauty of it, right? Is there's all different types of coffee, and there's a different time and different place for each one. So we still have the Nescafe, and there have been some days, especially with him, where it's like 3 in the morning, and you're just like, screw it, I'm not going back to bed. I'm just gonna stay up and do some work.
Exactly. Yeah. Oh my God. Yeah. We could have a whole conversation on the effect of coffee consumption and child rearing. We'll save that one for later. So let's start talking because I got a lot of moms. I got a lot of feedback when I posted this conversation and just trying to figure out what I was even going to call it. And I was like, you know what? Let's just talk about back pain. And so many moms replied like, oh my God, I need to hear this. This is for me. Because we all feel it, whether it's during our pregnancy, whether it's postpartum, from like day one postpartum to the rest of our lives. And I feel like this is one of those things that is like, it's common, but it's not normal and we don't have to live with it. So let's start talking. I'm going to hand the mic over to you. Why do we as prenatal and postpartum women suffer from so much back pain?
So there's two different parts to it, and this actually does tie into the coffee side of things as well, because the stimulants, obviously, if you're breastfeeding, that's going to limit the caffeine for a lot of moms. But the fatigue that you're carrying postpartum is a large part of it. The baby's crying. Now, as dads, we don't have that hormonal adjustment that you will, especially, again, if you're breastfeeding, that changes the internal environment. And then prenatal, essentially what we're looking at is as you go through the different trimesters, your internal environment, not just from a physical standpoint, but also from a physiological standpoint, is changing pretty drastically. So the hormonal environment is changing. You have the joints are essentially, especially in the third trimester, becoming more lax. It's called relaxin. It's getting the connective tissues to relax and allow more stretching, because otherwise the gift of childbirth is going to be a lot more challenging. So that's kind of the simple low-hanging answer that everybody can Google and look up. The other part of it has to do with, we'll grab my model here. Now this isn't a full model, but this is a lower back model. If you just imagine the crest of the pelvis comes off to the side. When you are going through child bearing, what happens is you get into essentially an anterior pelvic tilt, and you're going to have things exactly. And what that's going to do is change all of the forces in through the back. So you'll notice here, this top one, it's not supposed to do that. It's actually moving because it's lost some of its stiffness. The second one is more normal, where it doesn't move. I don't know if you can see that there on the camera, but essentially as you're going through, the body is changing in ways in its structures to be able to prepare for this momentous occasion. And as you go through that, all of the mechanics change significantly. So most of my focal area is cyclists and triathletes. It's a very unique position that they're in. And it's almost similar to carrying a child. Now, let's just make clear, I'm not saying riding a bicycle and bearing a child is the same thing at all. What I am saying is that when you're in that position on the bike, the rectus abdominis is turned off, essentially. And when you're carrying a child, it becomes stretched. And this affects everything. Now, a lot of people think that tight hamstrings have a direct correlation to back pain, and that has actually been proven false since somewhere in the 80s. And there's a number of research articles out there that show this. However, loss of range of motion and strength through range of motion, such as when you have that anterior pelvic tilt and the head of the femur kind of gets jammed back, does have a direct correlation to back pain and back injury later on. So that is a mechanical aspect that a lot of people miss. And this is where trying to maintain too much fitness through your pregnancy, and in my opinion, right now, we still don't really know what an average path is for good fitness as you're going through. What I've seen is, working with women prenatal and postpartum, is it really depends on how your body's dealing with the changes. and how you're carrying the child and how you're responding, as well as your life stress. And that's something a lot of people do not look at is, how stressful is my life? I've had some that have come to me where I'm like in my head, and I admit to them also like, hey, I think that you're in a high risk for this because, they just have that personality, but their life stress, the family is really supportive and they have almost no pain. Whereas other people where I'm like, oh man, I think this is going to go really well for you. And then they wind up being, some of the worst pain that they've been. And then you just find out everything with the family's going crazy. And you're like, well, how does that affect this? It has a direct correlation because that stress drives the internal environment and everything gets out of whack.
Yeah.
Does that kind of make sense, or is that too much down the off the beaten path?
No. It really makes a lot of sense. And I love that you had the example of the sacrum and the base of the spine, because we work with clients who, we take pictures and progress photos and look at them from the side, and they're not always like understanding why we care. But even like as a yoga teacher, we talk about our pelvis, and I use using the example as a bowl of fruit. So imagining you're standing up and your pelvic area is a bowl of fruit. We don't want it spilling out towards the front, which is when the booty pops out, which is the common response to pregnancy to bear the load. And we don't want it tilting too far backward, which is a weak abdominal issue or a weak hip flexor, lots of different considerations. But even if you're sitting here watching or standing, if you could stand up while we're having this conversation, not you, Malcolm, but somebody who's watching, put your hands on your hips and just kind of move your hips forward and backward and see if maybe you're naturally tilted back a bit or still tilted a little bit forward. Because the more that we understand like the way our body actually functions and the way it works, I feel like it's easier for us to start managing what's happening with it,
Yeah, and I think that this is one of the things that a lot of people are missing in kind of their understanding of back pain is, I have so many people come and tell me, well, I stretch my hamstrings, and that's not the answer at all. So I think that what you just said, the exercise of standing up and going through this is a great way to kind of get people to understand here is this is so important, not just for after, postpartum, but also in general. When you have a nice balanced bowl, and there's 3 diaphragms in the body. You have the base of the throat, you have the diaphragm itself, and you have the pelvic floor. In order for things to go back to normal after childbirth, because 100% of pregnancies that go full term have diastasis recti. It has to happen. That's how space is made. That's how the body works. However, to get it back, if you stay in this anterior pelvic tilt where you're kind of tilted down, you're essentially placing strain on the muscles and not allowing the rest of the muscles of the abdominal hoop to work together to create pressure and control. Now, this is where joint position will dictate muscle function, and a lot of people miss this. Again, my main thing is back pain and cyclists and triathletes, and the common theme here, as well with moms, especially with moms, when you have a crying baby at 2 o'clock in the morning who needs to be fed, you're not thinking what's the most spine-sparing way to pick up the kid, right? Even if you have, like we have the crib attached to the bed, so my wife can roll over and nurse him on her side. Mm-hmm. While that may be nice for a little bit, you do that 3 times a night for 6 months or 4 months, that leads to wear and tear. And that's where you can have these movements happen and you lose the stability of that joint. And maybe this is a better way to see it. So you can kind of see the joints back here are moving, because essentially you're moving from a tissue that's supposed to be stiff. The body's adapting to the demand you're placing on it, but that's not what it's intended to do. When you're in that anterior pelvic tilt, you're just putting all this strain and forcing the muscles. Some muscles are shut off. They say, hey, Jerry, I'm on vacation, man. It's like trying to get Kramer to do work, if you followed Seinfeld.
Yeah.
Right? There's no way it's going to happen. But once you get them into the right position, so finding that neutral position, Connie, like you just pointed out, is so instrumental in getting you back to normal and in life, whether it's prenatal or postpartum. And postpartum is forever, 40, 60, 80 years from now.
Yeah. And talking about like how we find out like are we progressing? Are we getting better? You mentioned that like it's not a one size fits all prescription for like how to manage your body through pregnancy and then afterwards. I've talked very openly about how terrible my 6-week checkup experience was because, as a first time mom, I went in like terrified, like, is my body broken? Is this pain normal? Stitches, just discomfort, pain in so many like uncommon places. And when the doctor came in, she was just like, do you feel depressed? And I'm like, no. And then I had to ask her to like palpate for diastasis because again, I assumed they were the expert. And they're like, okay, no internal exam, nothing. I asked because like, obviously I want to return to exercise, but they're just like, yeah, okay. And the things that you're talking about, these are orthopedic considerations, and it's not something that any personal trainer like is going to be able to help with because our undergrad, like general standard exercise science, degrees or just certifications don't cover prenatal and postpartum care naturally. So this is why we need to have these conversations and talk to specialists who know what's going on. So speaking of what's going on, Menachem, what should they know when they're hoping to start moving again in this postpartum period?
Well, the first thing is at the 6-week checkup, you're very overwhelmed. What a lot of people talk about is it's a newborn baby, but they don't talk about it's a new mom and dad. And I'm going through that now. I'm still learning, and it can be very overwhelming. I've been with those who know me, I've been very open, but I was one of those dads who was fine until I wasn't, and that happened around the 6-month mark, where there's feelings of not being needed, etc. And nobody talks about that. When I went online, and because my wife said, "Oh, they said that this happens," you hear about postpartum depression, but there's also the other side of it. When you go into the 6-week checkup, even if you go with your partner, you don't know the questions to ask. So these conversations like we're having are really important. So I would start at the 6-week checkup. Number one is listen to things, pieces of information like this. That's why I became a postpartum corrective exercise specialist, is because of that. I had women coming to me saying, oh, well, you helped so-and-so with her back pain after her pregnancy. Can you help me? And then it got to the point like, okay, well, that was clearly a back issue. She had that well before she got pregnant. This is a whole other thing. I need to find somebody who I can trust. And it's very difficult, even within that field, to find people who work well, because a lot of people are trained with a hammer, so everything's a nail. And that's where there's a lot of different skills out there, but it comes down to you and the questions that you need to ask. So let's focus in and give you a couple action items, you the listener, that you can do both at the 6-week checkup and beyond. So number one, at the 6-week checkup, ask them, do I have diastasis recti still? And they should put you onto your back on the table and have you put your feet on the table and just lift your chin up off the table while just pressing in the middle of the stomach. And that's a very fast and easy, heck, you can do it yourself, and that will help you. Number two is how much with the stitches and everything else that went on, if you had a vaginal birth, what considerations do I need to have when returning to exercise? This is where it gets very tricky. Some doctors are phenomenal in the delivery room, not so great at bedside. And this is where, and it's very overwhelming. Again, first-time parent, you want to find a doctor. Some people just want to get on with it. Some people don't like doctors, but ask around. Find out who has a great team around them that they can help you with. If something feels off, if you're unsure, this is all about you. You need to ask, hey, I noticed that the stitch is X, Y, and Z, or I'm still having bleeding there, or it's still numb. You have to say these things, and writing them down in a list is the number one thing you have to do. Do not be ashamed. I've had a couple women come back to me for their follow-ups at 3 months, and they wait. They don't even tell me on the phone when we're talking. They say, "Oh yeah, I didn't ask my questions." Like, why not? They're like, "Oh, I felt silly pulling up the note card." And they had issues that should have been addressed 6 weeks earlier, but they didn't because they felt embarrassed. Look, this is you and your body, so you need to take charge. And the doctor is there to serve you, not the other way around. And you have to have that mentality when you go in. That doesn't mean pick up my shoe. It means, hey, I understand you got a lot of people. I'm going to try and make this as simple as possible. I took the time to put together my questions. Mm-hmm. And the good doctors, if they really have to run, they'll have a nurse assistant or nurse practitioner come in and answer those questions and take the time with you. But you've got to take the reins. So that is number one to getting back to activity. Now, the other side is just a couple of different exercises that you can do at home. And these are where we can make any exercise a core exercise. The first is going to be lateral expansion breathing. And I think we sent a link here for that one, so we can take a look at that. Essentially, what this is doing is teaching you how to breathe through the full 360-degree diaphragm. So if we think of the diaphragm, and I have an umbrella, but I'm not super superstitious, but I'm enough that I'm not going to open an umbrella inside. So if we go, that's okay. So that was the active glutes. We'll go back to that one after. So the lateral expansion is where we're teaching the diaphragm to essentially open all the way around. So a lot of us tend to be neck breathers or belly breathers, but we're not actually getting our ribs to expand up and out in a full 360-degree way. And Connie, if, I guess afterward you'll have this in the notes or the comments for the folks. But this is a simple 23 seconds explaining how to do this. You could do this standing up, laying down, but you will be surprised, especially after carrying your little one for so long, how even if you could do this before, all these muscles are tight and you can't get them to release. So just practicing this, breathing 5 breaths in the morning, 5 breaths in the afternoon, 5 breaths in the evening, getting the ribs to expand out into the side and especially into the back will really help you be able to start to activate the diaphragm and the pelvic floor. And the cool thing about this is that this one exercise can serve a number of purposes. It's firing the muscle of the diaphragm and the intercostals and all these muscles that tend to get tight because you're nursing, because you're not sleeping well, because you're stressed, because you're caffeinated and you're overstressed if you're not breastfeeding. All these different things going on, we just tend to get tight and that shuts things down. But the simple act of breathing begins to change the internal environment and start to align the pelvic floor and the diaphragm. Now, the other side of things, and we talked about that anterior pelvic tilt, is we have to get the glutes to turn on just a little bit more. And the challenging part about this is a lot of us think, okay, I can fire my glutes. But when we actually get into an activity, or an exercise specific for that, we find that our quadriceps are turning on. We find that our lower back is turning on and everything except for the glutes are firing. So the other exercise would be a prone glute activation. And we can kind of look at that and see what that would look like. And it's actually very challenging. The model in this video actually did a fantastic job of this. And it's something, again, the mind-muscle connection for the glutes to the brain tends to get a little bit shut off because they're stretched as we go through childbearing because the pelvis is rotated forward. And if we skip ahead to, I think it's 2 minutes and 47 seconds, if I'm not mistaken. And a lot of the stuff on my, there we go, 2:17. So a lot of stuff on my channel is geared towards cyclists, but as you'll see, it applies a different cue to postpartum as well. So when she's going through here, what we're trying to do is for a postpartum mom, we would look to do an umbrella or the lateral expansion breathing we just talked about, and then to fire the glute as you're breathing out. So you're going to take a deep breath in. Notice she's getting great expansion in through the ribs there. You can actually see right between her shoulder blades, the shirt is expanding, and you'll see with my hand as well. She's expanding 360 degrees, and then she's firing her glute after that and holding for 5 seconds. Look at that breath. Look at how wonderful that is. Now, the other part of this is while you're there holding the baby, you're rounded forward. And being in this position, we're getting a passive stretching almost of the muscles of the chest, allowing you to get into a more upright posture. And this is something some moms will say that they get cramps in through the front of the shoulder when they're doing this. So we'll take a pillow and put their head on a pillow, put their hands to the side. But being in this position, the number one thing that I hear from this is I feel so much more relaxed than laying on my back. And the reason for this is you're activating the breathing. You're able to let the front of the body, which has been so tense, to relax. And this just sets the platform for getting you back to being active again. Now, these are the sexy things of getting back to activity after baby. The not so sexy things are daily activities, like how you pick the baby up out of the crib. I notice you have the crib, the travel crib there and in your vacay spot. Now, this is one of the biggest challenges for new moms and dads, more so moms, because you have all this other stuff going on, where how you pick the baby up is really going to affect if you're going to take yourself out of back pain or if you're going to keep yourself in back pain. Just as putting on your shoes will do it. So we'll look at two quick examples. So we'll pretend we'll do the baby out of the crib there first. So the first thing is, let's say the baby is in the crib here. Now this doesn't go any lower, but we'll say the crib edge is right here. What most of us tend to do is we just kind of round our back forward and then we lift this way.
Guilty.
Well, the simple way, and yeah, this morning too. That's how bad it is, right? Because we just don't think. The easier way, and of course, when the baby's crying, that there's that whole new level of stress. The easy way is just get right up next to the crib, slide the hands as if they're make a crotch with it, or an L, and you're just sliding them down the thighs. So you can get right next to the crib, the butt goes back, classic hinging motion, and then you take the baby, you move forward, you're getting a little bit of a brace, you pull the baby close as you can to the edge without hurting them, and of course under the armpits, and then you lift with your hips, and then you take the baby in the center as opposed to picking them up and putting them on the shoulder. That's the most common thing that we see is someone will take the baby, they'll pick the baby up and put them right on the shoulder, and we're coming across. That's flexion, rotation, which are two things we know that will not be very good. Now, for a crib on the floor like that, it's going to be a little bit more aggressive. And we'll have to kind of find, we're going to be using up a little bit, but coming down, then you're going to have to squat a little bit. But again, pull the baby close to you and then make it a deadlift to the belly button and then up. Now, the other thing, I don't have shoes in here. And of course, I took mine off because we just had the cleaner. That's the other thing. By the way, best investment, someone to come clean your house. It makes a very big difference.
Yes, absolutely.
That was my number one trigger. Number two, doing dishes. My wife laughs because now I do dishes like this. I take my feet out wide because now my back is straight, whereas before I was flexing. But these are the types of things where it was well worth it for both of us to have someone come clean because both of our backs would go. Now, for tying shoes, instead of sitting and rounding our back to get to the floor, simply putting it on a chair, and then you take your hip to the shoe, keeping your back straight, tie, come back, and then the same thing on the other side. Now, these seem like very silly things, and I've had moms and back patients tell me, this is really stupid, I'm not doing that. Okay, then in that case, this is going to seem harsh, but you deserve your pain. If you're not willing to do the small things, yes, I know. That's why I said I wanted to preface that because I know that. But if you're really looking to get out of back pain, we need to be serious about this. How many times a day do you pick up the baby? 30, 35, 40? If we can get you to be aware of that, but you're ignoring the small things like putting your shoes off and on, picking things up off the floor, what that's going to do is we're essentially, okay, we're going to do 60% of the work to protect you and keep you moving well, versus those small things are oftentimes where motor mistakes can happen. And that's where you have the mom who said, oh, well, I put down the baby and went to pick up a toy and my back went out. The motor mistakes happen either with a very heavy weight or a very light weight, and it kind of glitches.
Oh, that's a really good, that's really good. And I'm thinking of like a correlation. It'd be like going to your personal trainer at the gym and doing like 6 really great deadlifts. And then, 7 through 10, you're like arching your back and pushing the barbell away from you and then picking it up. Like you completely negate the benefit of the first 6 by messing up the last 4. Yeah.
Yeah, exactly. And that's why I say, and I deserve my pain. I'm in pain today. I deserve it. You know why? My wife came in last night and I'm sitting at the desk like this. And she's like, really? I was like, what? I didn't do anything. That's my initial response. It's like, you're the back guy and you're sitting here like this. I deserve my pain because I just lost the idea of, I just get tired and I just do this. We all do it. And that's where new moms have so much going on in their heads. I had no idea. Like I was working with postpartum moms before, but having a child and seeing it firsthand, like superwoman, like freaking superwoman. That is what it is. You're doing all this stuff, cooking and bottles and this and this and this. But we have to stop and take pause and say, if you're not taking care of yourself and doing these small things and paying attention, that's going to take away from later. And these really are the simple ways back. We could break down, and I had a list of about 7 or 8 things here that I came up with. And I was like, what am I doing? The simple thing is learn how to pick the baby up out of the crib, learn how to tie your shoes, and learn how to move in a spine sparing fashion. That's really what we need, as well as good breathing patterns. For most new moms out there, once you start to do that, the pain starts to go down. You start to be a little bit less stressed because your back isn't bothering you as much. And then what happens is you start to get better movement patterns, and that allows things to heal, specifically diastasis. We can heal that with good breathing patterns. Just that supine umbrella laying on your back, doing the umbrella breathing can do wonders if you let it. But it comes with the complementary stuff of how do you do the dishes? How do you pick up the toys off the floor? How do you pick the baby up? And after we do that, now we can start looking at, hey, don't go back to the gym and think, oh, well, I was doing this group class or this exercise, the deadlifts you were talking about. Your body is brand new. It has been through a trauma unlike anything else. Things have changed. The connective tissues have shifted. The muscles have changed as well. If you're still nursing, even if it's only once a week, I had a mom tell me, well, I'm not really nursing. What does that mean? Well,
Really?
like once or twice a week. Exactly. You're still producing, you're still lactating, which means the hormonal balance on the inside is still such that there's going to be changes that are going to affect you. So you can't go to the gym and expect to be able to do this HIIT class and not be hurt.
Mm-hmm.
And these are the things that a lot of us, and I can't speak to this, you can because you've been through this, my wife can. It's frustrating to say, I was just deadlifting the 32 kilo kettlebell. How come the 12 feels so heavy?
Yeah.
You have to remember your body just gave a tremendous life, just a miracle, and you have to be patient with it. And there are women on Instagram. One of them is an acquaintance of mine, and I've had numerous conversations with her behind the scenes saying, hey, I like your message, but you really need to tone it down, because even though your body can handle going back to that, that's not normal. That's really not normal. And that's something that a lot of people on Instagram, we're obsessed with Insta. It looks. But what happens is they get injured, then they don't post for a couple months, their audience goes down, or they say, hey, I was on vacation, and they pop back like nothing was wrong. But then you're like, if you know what was going on, you're like, that was a pretty serious thing. You should mention that. No, people don't want to hear about that.
Yeah. And it often goes back to like previous beliefs of what we think a good workout is, with the no pain, no gain belief, like, oh, well, it's just going to hurt. Hopefully I'll just keep lifting things and it won't hurt anymore. And yeah, I have a different shape now. And when I went back to exercising, I got that green light and I'm like, okay, I was still breastfeeding. I wanted to run. I was training to run the Brooklyn half marathon or something. And like 80% of the way into my training, so very close to like tapering part and getting ready for the race, I had this incredible shooting pain in my sacral area. And I went to the orthopedic because I couldn't even take a step. I couldn't walk. I had to like hobble home and I was in tears. And he thought it was just the usual pain that would be solved with a cortisone shot. But he was like, let's just check. We got an x-ray. He didn't see anything suspicious. He got an MRI. I had a 2 centimeter fracture in my sacrum, a stress fracture. And he kept asking me, like, did you fall on your butt? Did you have an injury? Did you have something? I'm like, no. But if I'm breastfeeding, like the more research I did, I was like, I don't think my bones were ready for this.
Yeah.
So I was out for the whole year because of just not knowing my body, just assuming I could go back. And I'm a trainer. I train women, I train moms, but like, this isn't normal. This isn't normal knowledge. So we have to keep asking questions until we find what works the best for us and what actually provides the help that we need in a supportive way as well. Cause I don't want to be yelled at to get my like workout done or saying like, no, you got to work through the pain. Like that is not a safe or believed thing anymore. Like we can leave that in the 90s where it needs to stay.
I wish I could say that that's the case, but now the more I travel, the more I see it's very prevalent is that you need to push. And the biggest success story I have to date of postpartum was the one who also kind of pushed me to get officially schooled in this. 38-year-old mom of 6, wonderful lady, very wonderful. Yeah, six. Every other year. Yeah. superhero in all means. And she came to me. She was actually dragged to me by one of her friends, longtime friends, who herself was a mom and was looking for the opposite side. She was looking to improve her fitness so that she could get pregnant, which actually wound up happening a year after. But this woman had been to numerous trainers who told her, yes, we can help you. You can help you. Here's my box as a trainer. And they tried to shove her in. And what happened is she got injured, got depressed, put on 5 kilos, went to another trainer, started to see results, overtrained, put on 5 kilos. So she came to me, I think 17.5 kilos over. And we just went the simple route. The first couple of exercise sessions, she's like, I don't feel like we did anything. I was like, well, how do you feel? She's like, well, I feel so much better than when I came in. I said, great, I did my job. And too many people have this thought that they need to leave an exercise session hammered. And some of it is, as a mom, I'm stressed. I just need to let this stuff out. Like how do we do that? And learning the boundaries and how the body is able to adapt, just like you're talking about, like until you have that injury, because as soon as you started saying my sacrum, I'm like, okay, well, maybe there was a fracture, maybe this or that happened during pregnancy. And I'm thinking about delivery. And then you're like, well, I was still nursing. I'm like, well, duh, yeah, that's a high risk. But you don't know until you know, right?
Yeah. That's a hard lesson learned. And talking about safe boundaries, I want to protect my time as well as yours. So yes, I know we could talk forever, which is why I love these conversations, because you can always come back. We got so much more discussion topics we can go into, especially for our athlete moms who really would benefit. So real quick, I have a quick question from a mom who asked about middle back pain, if spinal twists are helpful. Would you say it depends?
No. So here's the thing is, well, technically, yes. Technically, the answer is always going to be, it depends. I'm going to give the short answer and be very blunt here. No, because there's too many considerations, but they all have to be exactly perfect in order for it not to do damage. So number one, if you look at the spine model here, do you notice how it's almost like a lima bean?
Yeah.
So there's a lima bean shape, there's an ovular shape, and then there's a circular shape, a perfect circle, which is, fairly rare. Then we have the distance or the girth, like how wide the spine is. If it's perfectly circular and very narrow, yeah, you could probably get away with it. But the chances are, we know through the mounds of research that have been done, that rotation and flexion are two of the fastest ways to guarantee a disc delamination. Guaranteed. It's going to happen. It's not an if, it's a when. So now you see all these people, there's a specific method for running that's become very popular, where they use these tidal things, the water, where they're twisting back and forth. And that is actually one of the guaranteed ways to get into a back disc injury. Because what you're doing, the fibers of the disc, and I'm going to do the abridged version here, the fibers of the disc are essentially orientated counter to one another. So you have about 50% are pointed one way, 50% are the other way. But what happens when you produce a twisting motion is you're now turning off half of them and turning on the other half. So you only have half the support. Number two is when you're flexing, now you're getting the disc to deal with forces in a way it's not managed. Now in this model, if I push forward flex, you'll notice in the back, can you see that popping out there? I don't know if you can. I don't know if the camera angle's that good. Right there. Do you see that little dot?
Yes. Oh, yeah.
So that's flexion. Now, if we flex and we rotate, that's going to come out even faster. So that's a disc herniation, and that's what this model is meant for. So a twisting flexion, we can go through so many movements that we know it'll take time, but we'll get there. But if you add rotation to it, that won't work. What I would recommend, if this is something that you've been struggling with, and this is where you need to find the right clinician for you. If this is a long-term problem and you've had this before the baby or babies, I would strongly recommend finding a McGill method certified practitioner. And the thing that's unique about us is we aren't trained to here's our box. We do a detailed assessment to figure out the exact tissues and mechanisms involved to help you figure out what your needs are. So it's not a guess. We will tell you exactly where it is, exactly what's going on, and how to get out of pain. And if we don't know, we have a very wide network. And occasionally, if the pain doesn't fit symptoms or a certain pathway, it could be a number of other things, which we won't get into. But in short, twisting with weight, that's not going to be, it might feel good, but it's probably a shortcut to more pain later on.
Okay. And I feel like this shouldn't be like a don't twist anything ever, but for like within their range of pain management, like until that pain is gone. Like mind your yoga classes, mind any kind of like excessive twisting.
Yeah, learn to move more from the hips than from the torso.
Yes, it's like surfing and a lot of like exercise, like snowboarding, any kind of like activities. I learned how to ride a motorcycle, and you twist your whole body, not just your shoulders or your head. Oh, yes, it's all coming around. Okay, that's great. And the girl who asked the question is a client, so maybe I will find a way to connect you to, so you can have a better conversation about what's going on in her life. So wrapping up, if there was one thing, if there's just one action a mom could take today to help, start taking steps towards feeling better about what we talked about today, what is that one thing?
Great question. 5 minutes for yourself, laying down in a dark room or outside and practicing the lateral expansion breathing. But the 5 minutes for yourself, away from it all, no phone, or maybe your phone is your thing, but just quiet, calm, where you can just be you by yourself and practice that lateral expansion breathing. It can do wonders.
I love that. I love it. I love it. I love it. I think that's the perfect thing. I was going to say the same. I was also going to suggest start asking questions to anybody who is in your network. Ask in our group, contact Menachem, which is the next thing I was going to get to. But anyways, thank you so much, Menachem. Cheers to an awesome conversation. And to wrap this up, I want to thank everybody for joining us in this conversation today, but I want to remind you that it does not have to end. So if you've been to physical therapists or doctors and still haven't had that success in getting out of pain, you can reach out to Menachem by the links that we're going to share in the conversation. So let's keep this conversation going in the comments. I'd love to hear your takeaways if you have more questions. And remember, like, share, subscribe, invite moms to this group, and make sure you can, share all this information, start implementing everything we talk about. And if you get yourself into this community, please say hi. I cannot wait to meet you. So until next week, stay strong, stay caffeinated, and I will see you in the group. Thanks, everyone.